Think about the last time you felt genuinely sick. You probably took something. A pill, a tablet, a capsule, something you pulled from a cabinet or had delivered within a day, or picked up at a pharmacy on the corner. You may not have thought much about it. You felt bad, you took the thing, eventually you felt better. Now take all of that away. Not just the pharmacy. Take away the concept of a pharmaceutical industry. Take away the understanding that diseases are caused by microorganisms. Take away antibiotics, anesthesia, surgical sterile technique. You are sick. Your body is fighting something you cannot see, that nobody around you understands, and the only tools available to the people trying to help you are whatever plants grow nearby, whatever theories have been passed down through generations, and whatever seems to be working, even if no one can explain why. This was not ancient history. This was medicine for most of the time human beings have been alive. And what people did to themselves and each other under that system ranges from surprisingly clever to genuinely horrifying. The strangest part is how much of it had a kind of logic. A terrible, wrong, occasionally lethal logic, but a logic. Because the people practicing medicine in these eras were not stupid. They were working from the best framework they had. The problem was the framework itself. For roughly 2,000 years, the dominant theory of how the human body worked was something called humoral medicine. 4 fluids, blood, phlegm, yellow bile, black bile, were believed to control health and personality. Too much of one, not enough of another, and sickness followed. The job of the physician was to restore the balance. This theory was developed and refined by Hippocrates around 400 BCE and then expanded by the Roman physician Galen around 150 CE, and it ruled medical thinking in Europe and much of the world for over 1400 years. What that meant in practice? If you were sick, you probably needed to get rid of something. Bloodletting was the primary tool of medicine for most of recorded history. Think about what that means. You are already ill. Your body is already depleted. And the physician's instinct is to take blood from you. Lots of it. Sometimes up to a liter at a time. Doctors bled patients who had fevers, patients who had infections, patients who had chest pain, patients who had broken bones. They bled patients who were healthy as a preventive measure. The device most commonly used was a lancet, a small sharp blade used to open a vein, usually at the arm. But physicians also used a tool called a phleem, a multi-bladed instrument that could open several veins at once. And when they wanted a slower, more controlled bleed from a specific area, they turned to leeches. Leeches were not the fringe option, they were standard. A physician named François-Joseph Victor Brousset, practicing in France in the early 1800s, was so committed to leeching that he became known as the most murderous doctor in Europe. Not because he was malicious, but because he applied leeches to virtually every patient for virtually every condition. Brousset believed inflammation was the cause of most disease, and bloodletting was the cure for inflammation. He used dozens of leeches per patient, sometimes in sessions that lasted hours. France imported roughly 40 million leeches a year during the height of his influence. And yet, here is where it gets strange. Leeches, it turned out, were not entirely useless. Not for the reasons Brousset believed, but when a surgeon today reattaches a severed finger or reconstructs a piece of skin after a burn, One of the genuine modern tools they reach for is a medical leech. Because leeches inject an anticoagulant into the wound that prevents blood from clotting and pooling in reattached tissue. The mechanism was unknown for centuries. The effect was real. That pattern, the accidental discovery hiding inside a wrong theory, runs through the entire history of pre-modern medicine. Take the treatment of wounds. For most of history, physicians believed that wounds should produce pus. They called it laudable pus, good pus, desirable pus, a sign that the body was healing correctly. Surgeons would actually introduce foreign materials into wounds to encourage the formation of pus. This, as you can imagine, killed enormous numbers of people. Infection is what produces pus. Encouraging infection kills you. And yet, embedded within this completely wrong framework was one accidental insight. The physicians who poured wine or vinegar into wounds before dressing them were unknowingly applying an antiseptic. The alcohol and acetic acid killed bacteria. They had no idea why it helped. Their theories said it was preparing the wound for the correct kind of healing. The actual reason was that they were killing the thing that would otherwise kill the patient. Then there is the skull. The oldest surgical procedure known to exist is trepanation, drilling or scraping a hole through the skull of a living person. Skulls with trepanation holes have been found at sites dating back 12,000 years on every inhabited continent. Some skulls show evidence that the patient survived. Bone has grown back around the edges of the hole, which means the person lived long enough afterward for healing to occur. Why would anyone drill a hole in someone's head? The reasons varied by culture and era. Some trepanation was performed to release evil spirits. Some was done to treat severe headaches or epilepsy. Some appears to have been performed after head injuries, which, it turns out, is occasionally the correct instinct. When the skull is fractured and bone presses against the brain, or when bleeding inside the skull creates pressure, drilling a hole can relieve that pressure and save a life. Modern neurosurgeons perform a procedure with the same basic principle called a craniotomy. They were not always wrong. They were almost never right for the right reasons. Arsenic was used as medicine for thousands of years. Ancient Chinese texts prescribe it for skin conditions. European physicians prescribed it for fevers and infections well into the 19th century. A preparation called Fowler's solution, developed by the British physician Thomas Fowler in 1786, was essentially a diluted arsenic compound. It was prescribed for everything: malaria, asthma, skin disorders, anemia. For more than a century, it was considered a legitimate medical treatment. Arsenic is a poison. Chronic exposure causes cancer, nerve damage, organ failure. It killed many of the patients who took it long enough. But here is the thing. In 1910, a German scientist named Paul Ehrlich developed a drug called Salvarsan to treat syphilis. It was the first modern pharmaceutical compound, and it was made from arsenic. Because arsenic does, in fact, kill certain microorganisms, including the one that causes syphilis, Ehrlich was deliberately engineering what previous generations had stumbled upon accidentally. The wrong idea, practiced badly, concealed a real mechanism. That is the story of this entire era. But none of these treatments existed in a vacuum. The people who received them were also living in bodies shaped by diet, environment, and circumstance that made them both more vulnerable to disease and, sometimes, unexpectedly resilient. A physician in 14th century Paris treating plague victims with herbal poultices was not deluded. He was doing the only thing available to him in a world where the germ theory of disease would not be formulated for another 5 centuries. What collapsed this entire system was not a single discovery. It was a slow accumulation of people who decided to look at evidence instead of theory. In 1628, the English physician William Harvey published his work demonstrating that blood circulates continuously through the body, that it does not pool and stagnate as humoral theory suggested, but moves in a closed loop driven by the heart. This was not immediately accepted. Harvey was attacked by colleagues for contradicting Galen. But he had done something new. He had measured things. He calculated the volume of blood the heart could hold, estimated how fast it pumped, and showed mathematically that the body could not possibly be producing new blood fast enough to replace what bloodletting would drain. The numbers didn't lie. A century later, a Scottish naval surgeon named James Lind was troubled by scurvy, the disease that was killing enormous numbers of sailors on long voyages. Scurvy causes the body's connective tissue to break down. Gums bleed, teeth fall out, old wounds reopen. The body essentially comes apart. Lind conducted what is now considered one of the first controlled clinical trials in history. In 1747, aboard the HMS Salisbury, he divided 12 scurvy patients into 6 pairs and gave each pair a different treatment. One pair received citrus fruit. They recovered rapidly. The others did not. Lind did not know about vitamin C. That would not be identified for nearly 2 more centuries. But he had found the answer by looking at what actually happened instead of what theory predicted should happen. The distance between drilling holes in skulls to release spirits and deliberately engineering arsenic compounds to kill bacteria took 12,000 years to travel. But almost all of that distance was covered in the last 200 of them. You have access today to the accumulated result of everyone who decided, at some point along that long and often lethal chain, to test the idea rather than trust the framework. To ask what actually happened instead of what should have happened. To look at the patient who survived and ask what was different. The next time you open that cabinet and take the thing that makes you feel better, the chain connecting you to the surgeon chipping at someone's skull in 10,000 BCE is longer than it seems. And the distance between those 2 points is not mainly time. It is the willingness to admit, over and over again, that the current explanation might be wrong.